Today, let's look about the Wells criteria. And Wells criteria is a clinical prediction rule that helps to determine the probability that a patient has or a client has pulmonary embolism or not. While there are other criteria that involves the reverse Geneva clinical criteria and also the PECS rule. But Wells criteria is the intermediate. That is, number one is the reverse Geneva, and number two is the Wells criteria, and number three is the PERC, that is the pulmonary embolism rollout criteria. Let's discuss the components of Wells criteria. So we'll use the mnemonic unlikely clinical tip may help, where unlikely refers to other diagnosis that resembles pulmonary embolism, and we will score it at 3. And then we have clinical signs and symptoms, especially the signs and symptoms that we look at are the signs and symptoms of deep vein thrombosis, and if the patient has any, we award that patient 3. And then we have the T here, which is tachycardia. If the patient has a heart rate more than 100 beats per minute, we will score that patient at 1.5. And then we have immobilization, that is if the patient has been non-ambulatory for the past 3 days or has had surgery for less than 4 weeks, we will award that patient 1.5. And then we have P here, which stands for previous deep vein thrombosis or pulmonary history. It doesn't matter since when or for how long, but once the patient has presented or reported to have had deep vein thrombosis or pulmonary embolism, we award that patient 1.5. Then we have hemoptysis, that is coughing or blood. If the patient has that symptom, we will award that patient a score of 1. Lastly, if the patient has any kind of malignancy or cancer or history, it doesn't matter when, but we will have to award 1. Then the traditional score system was that if the patient has a score above 6, we will say that the patient has high probability of pulmonary embolism. But if the patient has a score of 2 to 6, that is, we term that patient to have a moderate probability. And if the patient has a score of less than 2, that is a low probability. But the aim of writing these scores is that if the patient has a high probability, now we won't bother going to PECS rule, but instead we will just go to the dimer test and the confirmatory test at the CT, pulmonary CT angiogram. If the patient has moderate probability or low probability, that's score of 2 to 6 or less than 2, we will go to PECS rule. And nowadays, we don't consider the traditional grading way. If the patient has a score above 4, we say the patient has a likelihood of having pulmonary embolism, and therefore we go to the dimer test and possibly confirmatory test, that's pulmonary angiogram CT. But if the patient has a score of equal to 4 or less than 4, we will we will go to the PECS rule and then later go to the confirmatory diagnostic test. Just remember the unlikely clinical tip may help, which is the mnemonic for PE components. Thank you for watching this video. Stay tuned for other videos.